It started when I was walking one day outside in the, we have a prairie path near us, and I broke out in major hives, and I didn't know what it was from. So that was, I think, the beginning of my health journey. And then after about a month after that, I had what I consider, I think, a seizure. I had some kind of episode. It was vertigo, it was throwing up, I was very sick. And so then I went to my doctor and was saying I wasn't feeling well. So he did a bunch of blood tests and upped my thyroid medication. And he was just saying, because I'm a mom, I have kids, he thinks I'm just tired. And I felt like there was more to it. There was something else to this. So probably a couple weeks after that, I went to the ER because there was one day where I was so fatigued I couldn't stand. And they did a bunch of tests, and they are the ones who found out there's something wrong with your heart. When you stand up, your blood pressure's going down, and your heart rate is going up rapidly and not coming back down. Like a normal person would stand up and their heart rate would go up and then it would come down. Mine was not. So then he sent me to go check out my heart. There was something wrong with my heart. So then I went down to a hospital and to a very good cardiologist and electrophysiologist. And they did EKG, bubble test, stress test. My heart was 100% fine. They thought maybe it was that I should get a tilt table test. There was this thing called PATS, which I had never heard of. So luckily he had done a 3-hour tilt table test on me, and based on that test, when they tilt you up and down, he felt I did not have PATS, and he was sure I didn't have PATS. He felt that it was something with my brain. So another doctor, another hospital, MRI of my brain, and there was some irregularities, so they felt I had MS. So for a while there, I thought I had MS and was looking into doctors and what I was going to do about it. Then I went to see another neurologist for a second opinion, and she felt I didn't have MS. So then maybe another month came by, and I had gotten into another very well-known hospital, and who has an autonomic center. So I went to that place, and they did really unbelievable tests, very intriguing. And based on those tests, when I went to go check out, they said you do in fact have POTS, and it is something you just have to live with. Some days you're going to feel good, and some days you're not going to feel good. That's just how it's going to be now. And that's devastating, obviously, because you think, how do you live a life if some days you feel good and some days you're not going to feel good? That just, like, I didn't know what to do. So when I got home, I called everyone I knew, did any kind of research I could do, and fortunately enough, my daughter, who was maybe in her 20s at the time, had a friend who had had POTS. And so I called the parents and said, is it okay if your daughter and I meet, and can I hear about her journey and what she's doing about it? And she was the one who said, there's this Dr. George out near us in Illinois, you gotta go see him, he helped me with my POTS. And I think with POTS it's normally young people, so that's luckily how I found this girl. And so I said, okay, let me give it a try. And so that's when I called the office and I made an appointment with Dr. George. Well, if I could back up a second, when I made the phone call, and I remember making the appointment, and I was at very close to my home, and I know exactly where I was in my car, in the exact corner, my phone rang. And it was this Dr. George, and I was like, a doctor's calling me? And he just introduced himself and asked me a little bit about myself and my age and my journey. And that was the first thing I thought, like, that was the first time in my life a doctor had called me on my phone to ask me questions. So I was like, wow, this guy, this is awesome. So that was my very first impression. My impression when I came into the office was, I was sitting in the room in this office, and he was saying to me, don't worry, I'll fix you. And I remember thinking, no, you mean you're just going to help me get off the couch? Because previously I'd been on the couch during all these treatments for at least 6 months, and I couldn't get off the couch without having like a seizure. And I remember staring at Dr. George and thinking, you must think you're going to fix me to get up. I could walk further, or I could walk around the block, or I don't know, I didn't think he was gonna fix me to having what was a normal life. So I just stared at him and I just kept saying to him, no, you mean you're gonna fix some parts that I could have a list of get off the couch. He's like, no, I'm gonna fix you. And I couldn't believe, by the time I had gotten to Dr. George, I'd probably seen minimal of 20 doctors and minimal 50 blood tests, Lyme's disease, all that stuff. And I just remember thinking, no one, not one person ever, not one doctor said you can be cured. They just said, take this, it's going to make you feel a little bit better. And it, you know, I'm nothing against meds, but they never tried to fix the core of the problem. They just fixed the symptoms. And I just remember staring at Dr. George as if, you've got to be kidding me. No one's ever suggested that I could be better. No one ever had said that to me. Fascinating. I would say the treatment here is fascinating. I couldn't believe the things they were doing and how different they were than what the norm is. I don't know what else to call it, but that actually they're gonna fix my interior body with me staring at either dots or beads, or that was just unbelievable to me and fascinating, that your brain has so much power to fix my autonomic system. That was just unbelievable to me. And so it was fascinating and awesome. It was, I could tell every time I was coming here, and each week and each month I was getting better and better, and I couldn't believe that just through my brain, my autonomic system was getting better. Everything. If I did not come here, I would be on the couch on medication to mask each symptom. I would most likely be on disability because I couldn't have worked. I couldn't get off the couch except for maybe 10 minutes at a time without having what I considered a seizure. And now I can live a normal life. I work, I have children, I swim, I do yoga, I bike, I walk. My life is 100% different than it would have been. I would have been on the couch and on disability had I not come here. Well, I would say that is one of my most frustrating things, is every time someone tells me their child or someone in their life may have dysautonomia or POTS, I don't know why they're not coming here. There is help, and they don't realize they could be better. They don't have to be on the couch. They don't have to be disabled in any way. That's probably I wish more people would do this and not live with POTS. You don't have to live with POTS. You can actually have a life, and a normal life, and do everything you were doing before. It is curable. It's not something you have to live with.